Hello, my name is Melissa Thorpe, and I'm going to be demonstrate the teaching strategy games. And we will be doing a game on infection control and prevention. Okay, here's your instructions, the isolation game. Thank you for taking pride in your work and in your education. The following scenarios are presented to test your knowledge regarding infection control prevention. You will be given a scenario and then asked yes or no questions. You will hold up your answer, yes or no, and without looking at the other answers in the room. If everyone's correct, great. If not, we will review the information. Scenario 1. Okay, we have a 78-year-old female. She's from a nursing home and she was admitted with a stage 3 sacral bed sore. She tests positive for MRSA nasal swab. Should she be, here's your questions. Should she be in contact isolation? Yes, good. Do you need to wear a gown? Yes. Do you need to wear a mask while giving AM care? Good. Do you need to wear gloves? Good. The patient next door is also MRSA, so you do not have to change gown or gloves. Good job. Always remove your gown and gloves before leaving the patient's room. Can you drop off the lunch tray without a gown? Good job. You always phone in and out? Good. And there should be a red stethoscope in the room. Good. Okay, scenario number 2. Your 64-year-old male patient is incontinent of liquid stool. There's a contact isolation on his door. You report that he has VRE and C. diff. You only need to worry about C. diff. VRE stands for very red extremities. What's your answer? Okay, good. VRE stands for vancomycin resistant intercocci. It can be spread person to person. You need to phone in before performing patient care. The answer is yes, you always phone in. Okay. Do you need to phone out when leaving the patient? The answer is no, because you need to use soap and water only on C. diff patients. Only wear a gown when cleaning liquid stool. Okay, good. Family needs instruction to wash with soap and water. And do you know why? Because they do not want to spread, we don't want them to spread the germs. Family needs to wear a gown and gloves when visiting? No? Okay, the answer is yes. You want to prevent the spread of the germs to other areas. We should discourage family from visiting multiple areas in the hospital, like the cafeteria. Good. They could also spread the germs. Okay, scenario number 3. Your patient was admitted with tuberculosis and has been on medications for 1 week. Okay. If there is not an N95 mask available, it's okay to use a regular mask. The answer is no. Only N95 masks or the respiratory hoods are able to be used with tuberculosis patients. Okay, you can only use soap and water to exit the room. Good. Foam can be used. You always have to wear a gown to enter the room. The answer is yes. The patient is not wearing a mask in the room. He or she is coughing and the aerosol particles are in the air and on the surfaces in the room. The patient has to wear an N95 mask to ambulate in the hall. The answer is no. The patient can wear a surgical mask to ambulate. The closeness of the mask will catch the particles before they aerosol out in the room. Family members must wear mask, gown, gloves to visit. The answer is yes, they have to wear a mask and gown and gloves. The patient must be in a negative pressure room. Good. Make sure that you keep the door closed. Okay, thank you very much. Was that okay?